Hi, good morning, everyone. It's Ryan Garst from NHIA, and thanks again for joining us for our office hours for our BAM pilot. Today, oops, sorry, hit the wrong button. There we go. Today, we're going to go over just some few program updates, and for anyone that was not on the call last week, we are going to briefly review teletracking and direct ordering again, as we're moving in those directions in the next week or so with the program. And then finally, we're going to have Bill Noyes, our Senior VP of Reimbursement, talk about some reimbursement issues that have come up in the last week and provide some clarity on that. In addition, we have three folks with us that we've been working with from HHS and ASPR, Tiffany, Jessica, and Diana, that will also be here to answer any questions regarding teletracking and direct ordering. So as always, please enter those questions into the question box, and we'll get to those at the end. So any questions for myself, Bill, or anyone on the teletracking and direct ordering, please enter those questions in as we go. So as always, we provide a quick program update. You can see that we have actually, this is the wrong slide. So I don't know how this slide got in here. But anyways, we've done 398 doses. I apologize for that, not 368. 398 doses in 18 cities and 57 cities. And roughly 80% of our infusions have been in populations of less than 100,000. I apologize, that chart is not correct. I will correct that before the slides go out for you all. And again, the majority of our infusions have been in skilled nursing facilities. 66% of infusions have been there. And again, we've allocated over 3,400 doses. This hasn't changed in terms of our ADR reporting. We have gotten some additional patients that we'll do some additional analysis on, but again, putting it in here just for reference that we've had very good success with very few side effects from the medication. Again, teletracking, please register by February 26th. And what you will be reporting is your current on-hand inventory and the number of doses infused. Most of you should have, or all of you should have received an email to enroll. But again, if you have not, please email hhs-protect@teletracking.com. You will then get an email to go ahead and register. We are asking that you still report the number of doses infused and the clinical data that you have been filling out, still reporting that to NHIA. As you know, as I've mentioned last week, we have written a white paper that's been referenced by Duke Margolis, and we are wanting to continue to look at clinical outcomes and the number of doses. We are one of the only programs that's collecting this kind of data. And so we would want to continue that. And I'll be having one of our program assistants, Jen Lyons, start taking over, sending out the email with the tracking form. And then Jen, Sharon, and I will still be points of contact for any questions. The teletracking SOPs, the link is here in the slides for you. And then that reporting is required every Wednesday. So again, if you have any questions regarding teletracking and the process, please put those into the chat or into the questions now. That way we can get those answered for you as we have our representatives with us today. Direct ordering, here is the link for that with ABC. Again, this is the form where you would go in and order product. We won't be allocating, again, like we have been, where we've asked for the number of doses that you would like to receive each week. That will be done direct order now from ABC. Everyone that is enrolled in our program that has received product is familiar with the process. It's just that instead of ordering and letting us know how much you would want, you'll go into this direct ordering link and order direct from ABC. Again, we will asking that you still continue to report to us the number of doses you have infused with that clinical information, and we'll send that out weekly. It has been very valuable information for us to be able to utilize for our advocacy for better reimbursement for the home setting and a variety of other conversations and topics that we've had with CMS and HHS and others. So it is very important that we continue to collect this data. Okay, Bill, I'm going to turn it over to you to go over some of the reimbursement questions.
All right, thank you, Ryan. This is a slide that I've shared over the past few open office hours meetings each and every week. I added to the bottom here that mass immunizers are to use place of service 60 on all claims. And these are just some of the common examples and reminders of how this billing works and is different than other times that you bill Medicare for services. There's a link to NHIA's billing and coding tool specific to the COVID vaccines and treatments at the bottom of this page, next page, or next slide. These are links to some areas that are very helpful when it comes to enrollment, codes, and rates. I wanted to point out that CMS did identify and assign codes for the BAM combination product, which is not part of the pilot, but I just wanted to point out to all of those that they have assigned a Q code for the product itself and an M code, the last two on this chart, for the administration of that combination product by Eli Lilly. Next slide. So the past few weeks, I've been asking providers to let me know if they've had issues with claims processing. And Wednesday of this week, I got my first report that mass claims were being denied by a number of providers in different jurisdictions. So I got the first report on Wednesday, and I let them know that this is really the first I've heard of this. It may be a sole situation. And then I started getting more and more and more notices and questions about why are these claims being denied. So I reached out to CMS yesterday. I got a very prompt response, and they're aware that the claims, these specific claims for monoclonal antibodies administration with the M code, are being denied, and they're working to address the issue as soon as possible with the MACs. Providers will not, and I've posted here their exact response. So I will keep you posted. I've asked them if CMS and or the MACs will be posting a notice to providers so they know that they're aware of the issue and understand what is being done to respond. So based on their response, you will not have to resubmit claims. They'll do a mass adjustment. And they don't know the timing, but when I know, I'll let you all know. And my contact information is here at the bottom of the slide. So that's all I've got, Ryan.
Okay, thanks, Bill. So a reminder again, please put your questions into the question box and we'll go through. But I think first, before we start, Tiffany, I'm going to put you on the spot. Is there anything you would like to add, Tiffany, regarding the pilot program in general, or anything related to teletracking and direct ordering while people are putting some questions into the box there?
Honestly, Ryan, thanks for the opportunity to be here. First of all, appreciate the partnership that you guys have really pioneered in bringing the monoclonals largely to the long-term care facilities and that community, as well as the great work you've done to collect the data. So thanks to everyone, the efforts within NHIA and all of your members to pull that data together. I think it's been really critical, a really critical piece of information. And I think from your slides, in terms of you really hit the high points on teletracking and direct ordering, and the shift is really just to kind of streamline processes and reduce the workload on folks, although I know there will be a transition period where that's not the case. So yeah, nothing really more to add. Thanks again though.
All right, thanks, Tiffany. So this one's for you, Bill. Bill, can you confirm if a modifier is required? If so, can you confirm the modifier is CS?
I cannot. I cannot, but I can look into that and get back to everybody, provide an update on this venue next week, and get something in next week's Infusion Express. So I understand the modifiers for COVID treatments, but I don't know if it's required here or not.
All right, thanks, Bill. So we have another question that came in, is that long-term care facilities are still struggling with getting adequate nursing staff. Is there a list of outside nursing agencies who are trained and able to assist long-term care facilities with monoclonal administration? I do have one answer for you. There is Infinity Nursing, who is a member of NHIA, is a national nursing agency, home healthcare agency that had reached out to us early on in the process and has agreed to help pharmacy providers with the subcontracted nursing to go into the long-term care facilities that administer the monoclonal Bamlanivimab. So there is a contact link for that on our website, on our BAM pilot page. Let me just give you the exact location there and where it is. I just want to give you the link. So if you navigate to our Bamlanivimab pilot page, if you scroll down, it'll have contracted nursing agencies, and essentially that Infinity is the one that has been providing some of that nursing assistance across the board. And thank you, Vicky, added in. She said Infinity Infusion has been great to work with. So they have been, I think initially there was a little bit of newness that they worked through, but in that newness, they were able to respond very quickly to an issue and did a fantastic job of resolving that issue. And then since then has been working with a variety of providers across the country. So Vicky, thanks for adding that in. But they were one that had reached out to us very early on when they heard about our pilot program and wanted to assist however they could. So I would refer to them, and they do have national coverage as well. All right, that was it for the questions. I'll give it another minute or two, but again, if you have not enrolled for teletracking, please do. And again, I can't reiterate enough that the appreciation that we have from NHIA for all the work and efforts that you all have put into the program. As Tiffany mentioned, it's been extremely successful. Our data collection has been very valuable. And so, while you'll be putting in a couple of data elements into teletracking, really continuing to send some of the number of doses infused and the clinical outcome data is really important, just for a variety of reasons that we've mentioned. So not only advocacy work, but just to assess the efficacy and how we're really making an impact in these patients' lives. We're now just short of 400 doses that have been infused in the program. And again, I apologize that table didn't update, but I will get that updated for you. In a relatively short period of time, and roughly about 10 weeks, we've done 400 doses. So that is really great work. I know a lot of you have put a lot of time and effort into it, so we really do appreciate it. All right, well, there's no more questions at this time. So,
Ryan?
Yeah.
Can I provide an update on the CS question?
Yeah.
I looked this up, and if you back up a few slides, there's a link to a Q&A. Can you back up a few slides? Yeah. Because I've located an answer. So at the bottom of this slide, there's CMS FAQs, and these are FAQs related to a number of waivers that have come about as part of the public health emergency. And CMS recently updated this around the vaccines and monoclonal antibodies. And they do state to utilize the CS modifier, which is the cost share waiver. So the patient does not have a cost share for the administration or the drugs themselves. And it does state to utilize the CS modifier for those claims. It is question number 27 on that near 100-page document.
Thanks, Bill. That's awesome. Great. Thanks for checking into that so quickly. All right. Still no more questions, so I think we'll wrap up today. Today is short. So thank you again to Tiffany, Jessica, and Diana for joining us today from HHS and ASPR. Again, we appreciate your partnership as well, Tiffany, so the feeling is very mutual. It's been a very great experience. And thank you all again for what you do every day. We appreciate it, and have a great weekend.